So, in addition to preventing migraines, it reduces severe muscle spasms, stops excessive sweating, tones down tremors caused by Parkinson's disease, and much more.
So I'm sure you've all heard of Botox by now, as the injection that is famed for curing fine lines and wrinkles has been all over the place, now that 20-year-old Instagram models are using it in their foreheads. But what you might not know is that there are tons of other ways that Botox can be used. Hey, what's up IOers? I'm your host Mackenzie Smith, and today on the channel I wanted to try something a little different that I think could benefit a lot more of you out there than you might think. That's why today I'm going to be listing the top 10 surprising uses for Botox that you won't believe. And I'm putting some strong emphasis on the you won't believe part. So Botox at its core is somewhat of a muscle relaxant. It blocks the nerves that signal your brain to move its muscles, therefore prohibiting your face from wrinkling like this. But by using the substance, you can also stop your muscles from contracting almost anywhere else on the body, which in turn has created some insane uses for the product. I also want to include a quick disclaimer here that we are not promoting or encouraging the use of Botox. And we encourage anyone who wants to use it after watching this video to research all the risks and of course go to a licensed professional to get it done. Okay, so now with all that, let's get into it. Starting off with number 10, cure acne. One of the craziest ways that Botox can be used is to treat acne. It's possible to completely treat acne by putting Botox all over the face, but it's not logistically possible as that amount would then constrict facial muscles and affect everyday movements. But a much better and safer option is to inject a tiny amount of Botox very superficially to help reduce oil production in small areas. And with this, normal facial expressions are still possible. Although it is recommended as a last result and patients are encouraged to use other acne control medications first through a dermatologist. The most common area that is used to successfully curb oil production is in the forehead, by the way. So I guess there you can get like a double whammy, like no lines and wrinkles and no acne? Next at number 9, we treat headaches and migraines. So even doctors are not completely sure how this one actually works, but all they know is that it works. And with minimal side effects too. One doctor spoke on this procedure saying, quote, "The theory is that it blocks the pain signals being sent to the brain and it relaxes the muscles in the head so they're not as sensitive to pain." So for this treatment, doctors inject Botox into the forehead, temples, and scalp. But doctors also urge this as a last resort if all other migraine treatments aren't working. And of course, along with any treatments like this, there are a lot of downsides to consider. The doctor continued saying, quote, "The problem is that neurologists who inject Botox for this reason don't always consider the cosmetic result. And some patients come in with fully frozen foreheads and dropped brows." So if you're thinking of this one, make sure to include the cosmetic effects into your decision. In at number 8, treats excessive sweating. Another insane treatment is that Botox can be used to help you stop sweating. Basically, since Botox calms muscles, it can prevent the message for your body to sweat. Basically, if your sweat glands don't get the signal, then it won't produce sweat and you won't be all sweaty. The medical term is called hyperhidrosis, and this is treated by injecting the area into the underarms or even the palms if you have sweaty hands. Dermatologist Amy Welsher says, "I've injected Botox into the scalp, forehead, and temples as well as the underarms, palms, and soles of the feet to stop excessive sweating in those places for up to 6 months. The results are significant." And the craziest thing here is that these treatments are actually approved by the FDA too. The doctor continued that this can be a life-changing treatment for people with pathological sweating, and that it's great for people who have tried clinical strength deodorants but still have issues. So I gotta be honest with you guys, this is something that I would actually use because, little known fact about me that no one asked for, I'm super sweaty, hence why I wear black a lot in like jackets and stuff, and even men's clinical strength deodorant doesn't always work on me. So I'll keep you guys posted if I pull the trigger on that one and end up getting it. Next up at number 7, make blowouts last. This one's more for the ladies. Another crazy treatment is getting Botox in the forehead up around your hairline so that you don't sweat or produce as much oil, and then you don't have to wash your hair as often, aka blowouts last longer. So it seems that some people have taken the no sweat thing a step further and began getting Botox injections expressly for the purpose of keeping their blowouts fresher for longer. Although the doctor in this article stated that she refused to give the treatment to people, as if too much Botox is injected in the forehead, you can get heavy eyelids, she says. So it sounds like investing in a new dry shampoo or figuring out some cute second day hairstyles might be a better way to go for this one, but if you're interested, the potential is there. Slide into number 6, overactive bladder. Another really cool problem that can be fixed with Botox can be an overactive bladder. One doctor spoke on this, saying that this treatment was one of the most impactful treatments she had ever seen to treat an overactive bladder. In one study, Dr. Linda Brubaker found that about 70% of women she treated with Botox reported about 3 leaks a day, compared with the average of 5 leaks a day at the start of the study. But like with a lot of things on this list, there is a catch. Sometimes if too much Botox is injected, it can actually shut down the bladder and people might need to use a catheter. So really do your research if you're gonna get this one, because probably the worst outcome ever would be to come out of the procedure with a whole new problem that needs fixing. And with a catheter too, like that doesn't seem worth it to me. Halfway through at number 5, depression. So this one's pretty recent, so take everything I say with a grain of salt, as some doctors are still a little skeptical about it. But early trials suggest that Botox may alleviate symptoms in people with depression. This is based around the facial feedback hypothesis, which suggests that a person's facial expressions can influence their mood. One small 2014 study of 74 people with a major depressive disorder found that 52% of people who received Botox reported a drop in symptoms 6 weeks later, compared with 15% of the people given a placebo. Allergan is currently conducting clinical trials to see if the drug can be used to treat depression, and the most effective way to do so. So if this is something that could benefit you, keep an eye out for this in the future. I think this would be crazy to treat mental health. Like if getting Botox could actually cure depression, that would be so beneficial for so many people. Next to number 4, severely cold hands. Another one that's crazy, but hey, if you need it, it's here. So there's actually a cold hand clinic at the University of Chicago, which in itself is just crazy. But anyways, at the clinic they use Botox to treat people with really cold hands. Botox is injected into the person's hand in order to relax the muscles that surround constricted blood vessels, which is the cause of the poor circulation. When the vessels relax and enlarge, blood flows through the hand and into the fingertips, and therefore getting rid of your cold hands. And with this you can get up to 3 months of relief. But watch out, as this one is not yet FDA approved. Coming in at number 3, jaw clenching. Botox can actually be used to treat TMJ, or in layman's terms, jaw clenching and teeth grinding. So basically in the bottom part of your face, right below your ears, there's this thing called a masseter muscle, and if you get Botox directly into that region, then the muscle will loosen up and won't be tight enough for the jaw to clench. As well, if the muscle has been built up through years of aggressive teeth grinding, it can also cause headaches or sharp jaw pain, which can also be alleviated through the Botox treatment. So here it relieves the jaw tension by making muscles unable to engage in the powerful, often unconscious movement of the jaw that produces headaches and pain. Although this treatment is not currently FDA approved, it has started to be recommended by dentists for treatment of TMJ. So hey, if you have this, you might actually be referred to it soon by your dentist. Coming in at number 2, Botox brow lift. So this is one that's also been called the Bella Hadid special. If you've ever wanted to have that sultry cat eye look like Bella Hadid or Dove Cameron, this might be for you. A Botox brow lift is a procedure where you can give temporary lift to the eyebrows through strategic placement. This works by relaxing the muscles that drag the eyebrows down, and once this happens, the upward pulling muscles of the forehead will start to bring the edge of the brows up. This will then cause a physical lift of the brows for as long as the toxin remains active, usually between 3 and 5 months. So this one is the only one on the list that's purely cosmetic, but I can tell that tons of celebrities are getting it recently, so I wanted to give you guys the inside scoop on this if you didn't already know how people are all of a sudden getting these crazy cat eyes. And finally, taking the number 1 spot, we have crossed eyes. So this last one I think is the craziest of them all. Botox can even be used to treat strabismus, or in layman's terms, crossed eyes, which affects about 4% of Americans today. So kids, if you keep crossing your eyes, then you might have to get this procedure as well later in life. Not gonna lie to you, this procedure is a little gross. Firstly, doctors numb the eye with some numbing eye drops, then after it's numb, a doctor will dispense a specific amount of Botox directly into the eye. Once the needle is assumed to be in the correct position, the patient will then be asked to blink, and a small amount of Botox will be injected into the eye, which is low-key giving me chills just thinking about it. Like, can you imagine getting a needle stuck right in your eye? Oh my god. And then also, who was the first person that had the guts to get this done? Like, I think I might rather have crossed eyes than be the one like risking treatment for that. But thankfully this treatment is out there as a great treatment for people that suffer from this condition and are looking for their eyesight to be straightened. Okay, so that's all for this video, and I want to know your take on all this. What's the craziest way to use Botox that you saw in this video? Mine is definitely the crossed eye one. Like, that's just so mind-blowing. Also, is there one that I forgot to include in this video that you know of? Please educate us all in the comments down below. Now, speaking of comments, I'm gonna shout out a few from my Instant Regrets video. Stevie Love said, Nair doesn't even work very well, let alone what the picture claims. How wouldn't you notice the rotten egg smell that all hair removal products have? Oh yeah, I haven't used Nair in so long that I completely forgot about the terrible smell part. But yeah, I think this one's pretty much confirmed to be fake after all the really good points that I read in the comments. So yeah, thankfully that girl isn't actually bald, even though I guess there's still a small chance, but pretty sure it's fake. Then Marilyn said, the rodeo girl didn't topple over other spectators. They were actually trying to catch her. I don't know what it's like in Canada, but at rodeos with country folk, men are much more likely to be chivalrous and try to help a woman tumbling down the hill, especially when she's a pretty blonde. But she took them both out, LMAO. Oh my god, that's hilarious. But also how nice of them for trying to help. But I bet they instantly regretted trying to help her. See what I did there? Then Capoto said, regarding number 4, painter's problems, walk back up the stairs, paint over your footprints as you go, then ditch your shoes when you're done. So this is definitely a solid idea, but definitely not ideal. But if there's no other viable option, then it sounds like the best one to me. Then lastly, Mark Alex Watts said, I regret my 11-year relationship. Spoke to me through this whole video. Aw, sorry about that, Mark, but I think we can all relate to having some regretful relationships. Stay strong, champ. And that's all for the comments. Leave me one down below and it might be featured in my next video. So that's all for the video. Leave a like down below and subscribe to see more videos like this. Thanks so much for watching and I'll see you guys in the next one.